When making sensitive decisions about reproductive health, access to accurate and reliable information is critical. If you're considering medical abortion with Cytotec, Misoprostol, this video provides a comprehensive guide covering how the medication works, its success rate, and safe usage under medical supervision. Please note that this content is for educational purposes only and does not replace professional medical advice. What is Cytotec? Cytotec is the brand name for Misoprostol, a medication in the prostaglandin class. It stimulates uterine contractions and cervical dilation, facilitating pregnancy termination in medical abortion. Originally developed to treat stomach ulcers, misoprostol has proven effective for reproductive health based on extensive clinical research. Success rate. Clinical studies show that medical abortion with misoprostol achieves a success rate of 85 to 95% when used within the first 9 weeks of pregnancy, provided medical guidelines are followed. The success rate decreases as pregnancy progresses, making early intervention key to maximizing effectiveness and minimizing complications. Factors affecting success. Gestational age. Abortion in early stages, up to 9 weeks, is more effective. Medication quality. Ensure the pills are genuine and properly stored. Adherence to medical instructions. Following the dosage, administration method, and timing precisely enhances outcomes. How to use under medical supervision. Medical abortion requires strict medical oversight. Below are the general steps typically guided by healthcare professionals, noting that specifics vary based on individual health conditions. Medical consultation. Consulting a qualified healthcare provider is essential. They will assess your health and gestational age to determine if medical abortion is suitable and provide guidance on dosage and administration. Preparation. Your doctor may recommend fasting for 6 to 8 hours before taking the pills to reduce nausea and ensure effective absorption. Administration. Standard dosage. Typically 800 micrograms, 4 tablets, taken 3 times with a 3-hour interval between doses, as directed by your doctor. Method of administration. The pills may be placed under the tongue for absorption through the mucous membranes or inserted vaginally, per your doctor's instructions. Post-vaginal administration. If inserted vaginally, lie on your back with your legs slightly elevated for 30 minutes to enhance absorption. Monitoring. After completing the doses, wait 72 hours while monitoring symptoms such as cramps and bleeding. Expected symptoms. Within 2 to 4 hours of taking the pills, you may experience cramps similar to menstrual pain, followed by heavy bleeding, which may include blood clots. This indicates the expulsion of uterine contents. Heavy bleeding typically lasts a few hours, then gradually subsides over days to 2 weeks. Warning signs. Seek immediate medical attention if you experience any of the following. Heavy bleeding, soaking 2 or more large sanitary pads per hour for 2 consecutive hours. Severe pain unresponsive to pain relievers. Fever, foul-smelling vaginal discharge, or other signs of infection. Medical follow-up. 1 week after using the pills, an ultrasound should be performed to confirm the abortion is complete and the uterus is empty. If the ultrasound shows retained tissue, your doctor may recommend an additional dose or a procedure like aspiration to ensure safety. Frequently asked questions. Is Cytotec always effective? It achieves up to 95% success in early stages, but it's not 100% guaranteed. Effectiveness depends on gestational age, pill quality, and adherence to instructions. What if the abortion doesn't occur? If cramps or bleeding don't start as expected, consult your doctor immediately. They may recommend an additional dose or alternative procedure. How long does the process take? Symptoms typically begin within hours of the doses, with heavy bleeding lasting a few hours and gradually decreasing over days to 2 weeks. Can it be used in later stages? It's most effective in the first 9 weeks. Use in later stages is less effective and may require additional medical intervention. How do I confirm success? Heavy bleeding and tissue expulsion are initial signs, but an ultrasound after 1 week is the most reliable confirmation. Conclusion. Medical abortion is a procedure that requires specialized oversight to ensure safety and effectiveness. Your health is the priority, so don't hesitate to consult a qualified healthcare provider or ask questions. This content is provided for educational purposes only, and and we encourage you to seek professional medical advice. If you have questions or need support, share them in the comments.